Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Ana Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome to Physician Heal Thyself, the podcast. I'm your host, Dr. Ana Lara. Hey, I have a question for you. Are you turning to AI for medical advice? Because I know a lot of people are. So I'm going to talk to you about what you need to know before you proceed with doing that. Now, I know that AI, there's a lot of benefits to it. There's a lot of benefits to technology, right? But in this episode, I want to talk about the deep, important questions about using AI for medical reasons. So if you're turning to artificial intelligence for medical advice, we're going to talk about that. And if so, what should you understand before you trust what it tells you? So AI tools, I know they're everywhere, and I know that they're using them a lot in medicine. And some of the use of AI is actually phenomenal because it brings accuracy to maybe evaluating imaging. It allows to be more detailed and specific, which is a great use. And there's many other ways, fun stuff, and some professional things that people like to use, right? So, but when it comes to health, sometimes we want an instant answer, response, and of course, AI is going to provide that to us. It can explain diagnoses, suggest treatments, and offer reassurance, right, in moments of fear. But when it comes to your body, your health, and your life, there are some critical truths that you deserve to know before proceeding. So let's get started. In this first segment, I want to talk about why people are turning to AI for medical advice. Many people seek AI guidance because, well, it feels fast. The answers, you type in your question and you get a fast response, right? Instead of waiting to get into a doctor's office. It's easily accessible. So it's available anytime, anywhere. You can plug in your question and it'll provide you lists. I know people have used it in a good way to say, hey, create a nutritional plan for me, breakfast, lunch, and dinner. Include these foods, exclude those foods, make it keto friendly, whatever it is. And it can whip out really quick a whole nutritional plan detailed right for you. And that's okay to use, right? It's private for the most part. I think privacy, it's on the internet. So I don't know if it's necessarily private, but you don't have to go into a doctor's appointment. You don't have to share any vulnerabilities to anyone, your fears, concerns. You can just type it in and leave the human part out of it. But I wouldn't consider it private if it's online. And, the explanations can sound pretty confident and organized for most people. Now, in moments of pain, anxiety, and uncertainty, this convenience is incredibly, incredibly appealing. And that's why so many people are using it. And to be fair, AI, it can be helpful for general education, understanding some medical terminology, preparing questions for maybe your doctor, and learning about some healthy habits, right? But education is not the same as diagnosis, and information is not the same as care. You cannot replace the education, the clinical experience, right, that a physician has with AI. So let's move into this next phase as we talk about the most important limitation that AI doesn't know you. And so before you go trusting AI with medical decisions, understand this. And even AI will tell you as a disclosure that you should not replace that with medical advice from your physician. So AI does not truly know your body, your history, or your context. It cannot perform a physical exam, doesn't know what physical exams to perform. It cannot see subtle clinical signs, something that a doctor would notice when you're coming in, that to you, it might not be a big deal. But if we notice that on a patient, we would assess it and test or look into. It gives us a sign of what to look for, what to screen for. It cannot interpret tone, pain, behavior, or appearance. It cannot integrate complex medical history the way that a clinician can. And it cannot assume responsibility for outcomes. So medicine is not only data, as we talked about in the last episode, when we talked about the legal responsibilities of a physician. AI, there's a relationship and pattern recognition, right? The intuition, accountability that a doctor has. And so these remain profoundly human interactions. So there's a huge benefit that when you see a doctor, they're able to notice signs. Sometimes it's the things that patients don't tell me that I notice, and then I ask, it prompts me to ask them questions. Then that leads me to realize I need to test for lupus. I need to test for Epstein-Barr, whatever it might be, right? And then we go from there. AI can sound certain, but even when it's wrong, it could be wrong. It might not be right for you. So one of the greatest dangers is that confidence language that we see that AI produces. AI's response may appear authoritative, provide detailed explanations, and offer a step-by-step guidance. I've noticed that AI has some sort of charisma. It presents things to you in such a way that, that it sounds very reassuring. That's what you should do. But yet it can be incomplete information. It could be outdated information because it's taking the collective information of what's on the internet. And so it could be misapplied to your specific situation, and it could be incorrect. I mean, it's not unusual that I get people, whether they're new patients or existing patients, that say, I Googled my symptoms and it said I had cancer, or I Googled my symptoms and it said go to the ER because I might be having a heart attack. And so it's not intelligent enough to do that full assessment like a doctor can, and then rule things out, rule things in, and then what to do next, right? And then also, it's so dependent on what you tell it. So AI is not asking you questions. You have to share the information. And as doctors, we know that sometimes patients just don't know what to tell us. And that's the interviewing process of asking the right questions that will give us the information that we need, right? That will prompt us to ask another question to get information. Sometimes we have to, doctors have to be very clever and very intelligent in their interview skills. That's the difference between a good doctor and a bad doctor. A good doctor knows how to ask good questions that's going to give space for the patient to share that information. And sometimes it's so amazing. I could see it in their eyes. I'll ask a question and then they'll pause and they're like, no. And we continue the conversation later on. They're like, yeah, actually, this did happen. I'm just recalling. I'm not sure why I forgot. I didn't put it in my paperwork. I forgot to mention, but this has been an issue. Because sometimes you don't even know if that thing you've been experiencing as a symptom since childhood, if it's even relevant to share. So you won't know what's relevant to share with AI. And so, like I said, we have to be careful. This can be, there could be an illusion of accuracy when we're using AI in medicine. So it can be very risky because you might not be sharing everything with AI that a doctor will have you share with them. If you don't know what to share, you don't know what to ask, it's going to be a problem. So the risk of using AI instead of medical care is delayed diagnosis, right? If you rely on AI as a reassurance, that it may cause someone to postpone urgent evaluation, ignore the worsening of symptoms, miss early treatment windows. Some conditions are time sensitive, and a delay can change the outcomes drastically. Look, I've had people who tell me, well, I had a lump, men will say this, I had a lump in my testicle. How long have you had this lump? All right, they'll say, I have a lump. How long have you had this lump for? Well, it's been like 2 years. Oh, you've had this lump for 2 years. And they're like, yeah, is it a small lump, large lump? What is it? And then you assess the lump and it's like, oh my God, it's the size of the testicle. Like, how did this person prolong seeing a doctor for that long? And now this mass is larger than it should have been, right? And so if that person put their symptoms on AI and they say, oh, it could be testicular cancer, it could be a spermatocele, it could be other things, and that person doesn't do anything with the information, guess what? AI is not going to hold you accountable. So then what do? Now you just have information, but you haven't done anything with it. And this concerns me more for men because I see that men sometimes are afraid when it comes to their health. They don't want to be vulnerable. Maybe they're a little shy, they're afraid, they have anxiety about it. And it can delay something that's time sensitive, right? That could have been dealt with early on, quick and easy. And now you have a bigger issue on your hands. Unnecessary fear and anxiety, when the risk is that if there's that fear and anxiety, as I said, AI may list the rare diseases and the severe complications and worsened scenarios, but without that clinical context, this can trigger panic in the person. So maybe making the problem bigger than it actually may seem. It can create health anxiety, excessive testing requests, sleepless nights. So information without guidance can increase to suffering. Just go see a professional. Just find the right one. That's what I say. You can start self-treating yourself without supervision, and you may end up on medications that are not appropriate, treatment plans that are not appropriate for you, supplements that interact with other medications. What I've seen with herbal medicine and AI is there's a lot of generalization. And see, botanical medicine is very unique, and most natural medicines are, because the physician knows, the naturopathic doctor or functional doctor knows what is the starting dose, what's safe for each person in different demographics, whether it's a child or a woman, a pregnant woman, what's safe in pregnancy, what's safe in a nursing mother, what's safe in an elderly patient. And so the dosing, the way of delivery, and then the quality of, if you're just finding these supplements online, you're not going to know, is the quality of that brand good? Is it efficient? Is it going to be effective for me? How much do I take? What's the therapeutic dose? Is it a quality supplement? So there's a lot of self-treating with poor quality supplements and herbs, and you're not getting anywhere. So you're wasting your time, you're wasting your money, and you're taking a big risk. While there's a lot of home remedies that are safe to do, there's also a lot of home remedies that, for a serious illness, you want to be careful with. You don't want to risk, treating a cancer and not having the proper guidance. There could be loss of human healing, the loss of human healing relationship. So healing is going to involve being seen, being heard, being cared for, being guided through uncertainty. And AI, can provide answers, but it cannot provide this kind of presence and compassion. And presence is often where healing begins. I want to share, my approach to individuals when I am consulting with them. They might be coming in for a particular condition, but in my interviewing process with them, in me asking them questions, something comes up and I'm like, let's screen, maybe it's in the physical exam or the history. I'm like, let's screen for that cancer, thyroid cancer, whatever it is. And then we do the lab work, necessary imaging. And when we consult and review these findings, I've taken already the time to assess the results and findings. I've taken time to pray about this. What is the course of direction that I want to take this patient through? What are those treatment options, right? I want to provide at least 2 or 3 different, sometimes 2 directions, a natural convention, a conventional direction, and a combination of both, and allow the patient to decide. And so I've already mentally calibrated myself emotionally. I have calibrated myself to be balanced so that when I sit with this person, I'm going to present this in a being realistic, being serious, but yet with hope. Because when I present, conditions, I'm diagnosing someone for the first time. So someone's coming to me, I'm diagnosing them myself with a cancer or autoimmune condition, right? Something that's a rare condition maybe. I want to be sensitive to them. I want them to take it serious, not downplay the seriousness of their condition, but I don't want to leave them feeling anxious and fearful and they leave my office in panic, right? Sometimes the seriousness of the diagnosis is enough to wake them up, shake them up a little bit to take things serious. So when I present things to them, I always set up the prompt properly and say, this is information that we are sharing today, we're discussing. And I want you to look at it this way. I don't want you to get married to the diagnosis. Do not identify and get attached to it. This is where we're at, and I'm here to give you hope of what are some potential treatments that we can do. And I've seen these conditions. If I've seen this condition be, in remission, go into remission, then I'll share those stories with him. But then I'll go through the diagnosis and say, the lab findings, the lab results, the imaging does confirm that it is, say, thyroid cancer. And so, and I'll point out the positive, if there's positive things about it, and I'll point out to the negatives. And then we'll talk about what it's going to consist for them to change in order for them to heal from this. And very serious, we got to change the diet. We're not playing with this cancer. You got to eliminate all the sugars, all the carbs. We're not going to feed the cancer. We're going to starve it. And we're going to give your body the terrain, all the necessary things to fight that cancer. And we'll talk about what are the additional, remedies, treatments, whether they're IV therapies or things that they're doing at home, lifestyle. I also always speak into the point of prayer and meditation, helping the nervous system, right? To help the nervous system to restore, to heal, to be in a parasympathetic state, to be relaxed so that they can further heal in their process. And then I even talk to them about how do they communicate this to their family? Who should they communicate it to? Who should they not? And I do always tell them, don't go telling everyone you have cancer. Maybe just share it with people who are going to be support systems to you. We don't want their negativity, their fears to be projected onto you. This is a time that you need to protect your peace of mind and feel safe and feel, calm to heal. Because if you're not in a calm state, you can't heal. So see, all of these things that I'm sharing with you, AI is not going to do that. It's just not going to do that. It's not a human. It cannot adjust itself emotionally, intellectually to every individual person. It's just giving you information. And so this is where I caution people of taking your lab results, not consulting with your doctor, and just going on some online AI platform, plugging in your values, and then it spills all this stuff out to you, and you're vulnerable in those situations. You truly are, because you did not study medicine, you did not study the sciences to understand the severity of the situation, or maybe it's not that serious and you're stressing about it now. And more often than not, I see people that are freaking out about little things, and I'm like, no, it's not that big of a deal. Or people are following treatment plans that I'm like, that's not the right thing to take for that. So there's a lot of generalization when it comes to the use of AI. So that's the difference between, AI and a doctor. Now I know that not all conventional doctors work that way. I'm sorry again. I apologize that I don't have a bigger influence in conventional medicine, but maybe find a doctor who is. I still see a lot of good conventional medical doctors that are communicating the best. I have personally had good experiences with endocrinologists and gastroenterologists and cardiologists that I have witnessed either directly with me or a family member, that they do have compassion. They're listening and they deliver information in a very sympathetic, very empathic, compassionate way. And so I do see a huge change in medicine. Now, in this next segment, I want to talk about when AI can be used wisely, because like I said, there are times that, it could be a supporting educational tool, but it's not one it's not a decision maker. So learn information, great, but don't make a final decision until you discuss it with your physician. So some healthy uses can include learning the basics of health information. You want to understand how cortisol works. But then again, there's so many things on the internet that you can learn that from as well. Understanding a diagnosis after seeing a doctor. So maybe you want even further clarification than what your doctor was able to provide to you. Hey, I did that back in 2006 when my doctor diagnosed me with thyroid disorder, and I didn't know what it was. I didn't know where it was. And I was too embarrassed to ask my doctor, what is a thyroid? Where is it? And what does it do? So I went home and I plugged it into Google, right? We didn't have AI then. We plugged it into Google and I learned about what is a thyroid gland, where is it located, what does it do, and so forth. So that's fine if you're wanting to understand more. But then again, the internet in general can give you information on that. It can generate questions for your appointment too. Maybe you don't know what to ask your doctor. It can help you generate some questions. Reviewing lifestyle strategies like sleep, nutrition, exercise. Those things are not going to be harmful for you. So in this role, AI can become a bridge to better care. And it's not a substitute for it, but it can bridge for more education. So some warning signs that you may be over relying on AI for medical care. You want to pause and reflect if you notice these things. So I'm just going to read these off to you. Avoiding medical appointments while repeatedly asking AI. That's a problem. Trusting AI more than a trained clinician. That's a problem. Feeling more anxious the more you search, that's a problem and a sign to stop and step away. Trying to diagnose yourself alone, serious problem. Making treatment decisions without professional input, that's dangerous. So, if it's telling you to eat oranges or take vitamin C or vitamin D, that's not going to kill you. But if the condition you have is not being properly treated and you're just doing it on your own and relying on AI, that could be a serious, serious problem. And you're over relying on something that's artificial. So these are signals to reconnect with real medical care. And I totally get it. Look, I have experienced it. A lot of my patients have experienced it. So many of my patients, I would say that 9 out of 10 people in my clinic have shared with me medical trauma. That's right, abusive medical trauma that they've experienced. So I don't want to downplay that. There are issues in the medical system, right? But this is not the way to resolve it. The way to resolve it is to find a doctor that is willing to listen to you, right? And educate you, inform you, work with you, collaborate with you. And that's respectful to you as well. And communicate with them. I have had, unfortunately, some major traumatic experiences with doctors. And if you feel safe and comfortable, name some of them, because then they'll understand where you're coming from. And they'll be it'll be on their mind when you come in. They will know, oh, we need to be careful with, just be careful how we approach and communicate. So some of the questions to ask before trusting AI advice is before acting on any health information, consider these 5 questions. Has a qualified clinician evaluated me? Could this be urgent or dangerous? Am I using AI to learn or to avoid care? Does this advice consider my full medical history? Because I'm saying if you're only telling part of your history to AI, it's just going to treat you based on that information. If you're intentionally or unintentionally excluding that information, it won't know what else to consider. And this is where doctors, in my opinion, come in. and with their amazing interviewing skills should be asking you all the right questions, not just on paper, but in person when you're sitting across from them. The fifth question would be, what would I feel safe if someone I love followed this instead of seeing a doctor? And that question right there usually changes, right, the direction of how, whether we can trust this advice or not. And these questions, restore clarity and responsibility. And, maybe you need to take a couple deep breaths, do some praying, do some meditation, and then reach out to your doctor and just be open with him about where you're at and how you're feeling. A lot of people are using AI. It was not on my radar as a clinician until I had a couple situations happen that I thought were very rare. A first-time patient consulted, everything was well. I'm very upfront about how I work with patients and the flow that I take on the first visit, second visit, and future visits. And so my standard process is, in the first visit, we will evaluate, ask a lot of questions, examine, so forth, determine which labs or imaging to do, give the orders to do the imaging and labs, and then any potential treatment things, lifestyle changes, we'll provide that in that first visit. And the patients who go do the blood test, and when those results come in, they come in and we review them. We do not release results after that first visit. We wait for the patient to come in. We review the results. And by review, it's really an educational opportunity. I explain in detail to my patients everything. What are those tests? What do they mean? Focus on the abnormalities, the out of range categories. Explain what our optimal range is. What is the target that we're aiming for? And explain why their signs and symptoms that they're experiencing correlate to the labs. And then we go over the best part, which is the treatment plan. How do we fix this? Right? Because we don't care about the labs, really. It's how do we fix the problem? Because you can get all the labs done, but if we don't have a plan in place to get you to feel better, they're kind of useless. So it's just information. And so then we talk about the treatment plan, give them options, and get it going, whether it's starting supplements or herbs, if there's prescriptions or compound pharmacies involved, whatever it is, we make sure that everything is initiated that day, and they leave with the treatment plan that's detailed and written out for them to turn to if they have questions. And I review those treatment plans at least a good 3 times before they leave my office. Do you have any questions? And so forth. So then after that, I give them a physical copy and I will send them a digital copy of the labs. So when I start getting patients that after the first visit, they do the labs and they want the copy and they don't want to come in to see me after that, that's not the way we work. And this is why the last episode on the legal responsibilities of a doctor to review labs, this is why we're having these conversations, because I need to make sure that people understand that this is not acceptable behavior in medicine. If you want to do your labs and pay for them yourself and not consult with a doctor, in Arizona you can, for the most part. Most labs you can order them yourself, pay for them. Insurance won't cover them, but you can pay for them yourself and do them. Now the question is which labs and so forth. You're on your own. So if you want to take complete control of your health only and not have anyone involved but just you and AI, you can. But you're taking on the risk by not being sure, like 100% confident that you're understanding and that you're receiving the right approach to care. So that's just my advice to people is you can do that if you want, but don't get a doctor involved. Go pay for your labs, get it done, evaluate them yourself. You can monitor your health, but then you're responsible for that. I personally don't think that's a safe way because there could be so many things that are out of your sphere of education, of experience, clinical experience, that you don't have that you may be doing the wrong thing. And that process of healing may be prolonged, and you might be spending more time, money, and energy and hurt yourself in the process than just getting someone, right, to fix the problem. I always use car analogies. We take our car to the mechanic all the time, right? If the car is making a noise, we don't know where it's coming from. For the most of us, I don't know where it's coming from. It's just making a noise. And the mechanic will run and do its diagnostic. All the technology's there. They do their diagnostic and they find where the error is. And then they're able to fix that error. Now, if they were to find, here's the problem, this is why your car is making the noise. And I'm like, okay, thank you for telling me. I'm going to take my car and fix it myself so I can save myself money. Yeah, no, it's not going to work. Why would I spend time trying to figure out how to fix my car, which I have no orientation, I have zero understanding of what my car, how to fix it? I would be wasting a ridiculous amount of time and I would get nowhere. So I trust the mechanic that they're showing me, this is the problem. Here's what we need you to fix it. Here's the cost. Of course, we want people who are being upfront, right, and honest with us, transparent about cost and what needs to happen to be fixed. But this experienced mechanic, right, educated in this, will know how to fix that problem probably in 5 or 10 minutes, depending on the problem. Where for me, it would take days and weeks and months and years, and it probably would never get resolved. So I can cough up the $1,000 and have the mechanic fix my car, or I can just keep driving it until it breaks down on me. And it's unfortunate that we prioritize material things over our physical body. It's like we don't see the value of ourselves. Our physical body is the vehicle that our spirit and our soul is being transported in this life. So we need to take care of that body. All right, on to the next segment. A balanced perspective. So the goal is not fear of technology. I don't want you to be afraid of using AI. No, just be responsible with it. It's fun to look things up, but don't completely rely on it 100%. Don't be blindly trusting in it. The goal here is wisdom. Use your wisdom. AI is a remarkable tool for learning, but medicine requires judgment, accountability, and compassion, and all grounded in the human relationship. So your health is just too important to be guided by convenience alone. So I get it. For some people, you're generally healthy, not a big problem. But for those people who have a lot of chronic conditions, chronic disease, you don't want to take the risk. So if you're turning to AI for medical advice, just pause for a moment and be honest with yourself to reflect on this and ask yourself, am I seeking information to avoid care? Because I find that that's really it. There's an anxiety there. And so we need to work on that anxiety and that fear of seeking professional medical care. The true healing rarely happens in isolation. It happens in relationship, responsibility, and compassionate guidance, right? And technology may inform your journey, but it should never replace the people who are trained and called to walk that journey with you. So I want to thank you for listening to this episode of Physician Heal Thyself. If you found this information valuable, please share it with someone. I really feel like we are embarking on something here that a lot of people are heavily relying on AI for many things. And while it could be fun and cool, there's just some risks that you shouldn't take. And this is one of them. Don't be plugging in your values in AI tools to get this, to tell you what to do and not having that discussion with your doctor. AI is not going to replace this kind of experience. And I know there's a lot of talk about how AI will replace many careers and professions out there. Yeah, only if we allow it to. If we allow that to happen. I still want a person to teach me, to teach children. I still want a person to interact with me for a lot of things. And so I hope this message has just brought some information, maybe something into your awareness. So until next time, remember, protect your health, seek wise care, and remember that your life deserves more than an algorithm. So until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.